Addiction is a disease. It's really important to just say that out loud. People think that well, if they would just not use, well, that's a lot easier said than done. Addiction it's a brain disease. It's a disease that affects the brain, and people lose their ability to choose. That's the part of the brain that it affects, is the part of our brain that makes wise choices. So it's really important for us to know there's a physiological and a psychological part to addiction. And so I want to make sure that people hear that, and that if we want to have questions or discussion about that later, we can. Opiate addiction is on the rise, not only in our community, but across the country. Okay, in 1997, Ohio got, for every person, that's man, woman, child, infant, whatever, there were prescribed 7 opiate pills. So 7 Vicodin, Percocet, hydrocodone, Oxycontin came in a little bit around there. So those pills, for every, in 1997, each of us had 7. In 2010, each of us in Ohio had 67. Now, I don't know about you all, but I didn't take my 67. And I'm pretty sure that most people didn't. Here in Hamilton County, the per capita dosage then was 62 in 2010. It stayed stable it went up in 2011 a little bit, stayed stable in, our newest data talks a little bit about 2012. We know that the pill mills were closed, and so that it's going down a little bit, but predominantly it's staying pretty level at that 67 pills. The highest county in Ohio had 123 pills per person.
What county was that?
Scioto. But actually Jackson is a little bit higher, and they had 136 pills per person.
Couldn't part of that increase be due to the aging population? I mean, you do get more aches and pains as you get older. So
could be, but it's predominantly the prescribing habits of physicians, and the things that were, hey, please come on in and sit down. The prescribing habits and the things that were encouraged for prescribers. Hospitals were charged with not allowing people to leave with pain. You know, they needed to ask, are you in pain? Do you need something to help you with pain? And prescribers, you know, many times are not taught. Physicians in medical school, they're not taught a lot about addiction. And so they're taught a lot about prescribing and about how to prescribe and how to do that. So it's not their fault, but that's part of it. So aging population, more access to prescription pills, more prescription pills on the market, and sort of the mandate, although that's probably a stronger word than I would want to use, to not let people be in pain. And what do we see on the TV? If you're in pain, take this pill. If you're in pain with this, take this pill. If you're having this problem, take this pill. So we've become a pill-taking culture. So that's part of it. Yeah.
And in the paper, I know you talked about the Joint Commission on Hospital Accreditation making pain management a vital sign.
Yes.
When was that?
That happened in early 2000s, so probably 10 years ago.
Okay. And that probably played. So people, they weren't supposed to, as quality of care issue, they shouldn't be leaving the hospital in pain.
Right.
Whereas years ago, you had a broken arm or something, they take
exactly. And you know, I don't know about you all, but I've now had several dental surgeries, and I had just had knee surgery, and every time I walked out with a prescription for 20 to 30 Percocets, hydrocodone, Vicodin, whatever. And I mean, I'm like, I don't need this. I don't think I'm going to need it. Could you give me a prescription for 10? You know? Well, it's going to cost you the same. I don't care whether it costs me the same. I'm not going to take the rest of it. So that it was really very difficult. One of the things that we know is that the correlation between the rise in prescriptions and the rise in fatal unintended drug overdoses is a correlation of about 92%. 0.92 something, 8 something. So, you know, you don't see those kinds of correlations. Things don't match up that well unless they really are connected to each other in some way. So the prescribing definitely has an effect on the what happens. The other thing that we have seen over this time frame is the growth of admissions into addictions treatment centers for opiate use. Okay, this is a slide that shows the hot spots in red for opiate admissions to public treatment programs in the state of Ohio. Okay, the scale that they used then was that a hot spot for opiate addiction started at just under 7% of admissions, and the top program that had opiate admissions had 14% at that point. So using, you know, removing that top number, but using about 6.8% as this is a hot spot, I'm going to go through some slides that show you some changes over the years, 2007, 2009, 2011. And it now goes up to 70% of the clients in treatment programs, and that's 2011 data. All of the treatment programs that I talk to are at 80% or higher of their clients are opiate addicted, and it is truly sweeping our communities. Okay.
Is that voluntary admissions or?
Those are voluntary and things like drug court, which are voluntary, but you know, do you want to, you know, what do you want? Jail or treatment. I mean, it's voluntary, but some people choose jail. I mean, some people truly choose jail because they do not want the strictness that you have in a drug court setting.
And this, when you say percentage, this is for addiction programs altogether. You're just looking at, it's the percentage that are there for opiates?
Yes. But how many, what percentage? In those earlier slides back here, you would see a real mixture of alcohol, cocaine, other drugs, things like that. But now we're seeing almost entirely opiates. And I would say that most of the programs that are here in red are showing, they're showing 50% or more. I mean, even though the low number here is still the same as it was back in 2003, 2001, 2003, of 6.8%, they're much higher than that.
And what's happened to the crack addicts? Where are they? Are
they people aren't using crack.
They've switched.
They've switched. Okay, now I have my own little theory about switches from one drug to another, and it's a historical theory, and that is when the society is up and doing really well, people want to be up, they want to stay awake, they want to be out partying, they want to be doing lots of things. So in the 80s and 90s, what did we see? We saw cocaine. Now, things aren't so hot. And so people don't want to have to deal with the world. They don't want to